Hi everyone! In today's video, we're going to go over CBA practice questions for your Inspire Global assessment to help you feel more prepared and less anxious for your exam. So let's get started. Here's our first question. You are updating the physician about the client who has had increasing shortness of breath and a drop in oxygen saturation. Which of the following SBAR statements best communicates the situation? Letter A, the client's not doing well. I think you should come check on them. B, the patient is on 2 liters of oxygen and has an O2 sat of 91%. I'm not sure what's going on. Letter C, the client has shortness of breath. What do you want me to do? Or letter D, this is Nurse Lee on the medical unit. I'm calling about Mr. Singh. He is post-op day 2. His O2 sat has dropped to 88% on 2 liters nasal cannula. I suggest we increase oxygen and order a chest x-ray. Are you okay with that? In this question, it's very obvious which one is the answer, which is letter D. This is the only option that follows the SBAR method: situation, background, assessment, and recommendation. This question is something you should expect during your CBA questions, but also during your SLA, is how to communicate using the SBAR method to the physician or even to other healthcare professionals as well. And here's a test tip for you. Know the SBAR very well. How can you use it? How would you use it when you are calling the physician, the healthcare professionals, or even when you're doing a handover? For the SBAR, always start with introduction. So introduce your name, what unit you're calling from, state the reason for why you are calling, give some medical history, the clinical context, your assessments, what's the patient's current status, and make a clear recommendation. When you're calling the physician, don't just ask what to do, but show your critical thinking and your clinical judgment. And that is something that you will be assessed as well during your SLA. So for our next question, which of the following findings should the nurse report immediately when caring for a client with pneumonia? A, respiratory rate of 22. B, crackles heard on auscultation. Letter C, oxygen saturation of 88%. And letter D, productive cough with green sputum. And the answer for this question would be letter C, oxygen saturation of 88%. As any O2 saturation below 90% indicates hypoxemia. And this is a critical finding for you, and this requires for you to do something right away. So for this situation, this is when you can administer oxygen therapy. So here's my test tip. Always compare abnormal findings to normal findings. So for you to do that, you need to know what are your normal findings. And it's not just for oxygen, but also some lab, your common electrolytes, and your glucose level as well. And then determine if they require urgent action. And when you're doing your CBA, of course, you need to choose the answers that will prevent your patient or your client from deteriorating. Here's our next question. A nurse is caring for a client with schizophrenia who states, the voices are telling me I'm wordless. What is the nurse's best initial response? A, why do you think they're saying that? B, you are not wordless. C, it must be upsetting to hear that. Or letter D, try to ignore the voices and focus on something else. Based on my experience and my observation when I'm doing private coaching clients and when talking to other IENs and when I used to be a nursing instructor as well, mental health is one of the topics that IENs struggle with. And if that's the same for you, ensure that you prepare very well for mental health during your CBA and your SLA. But let's get back to the question. So what do you think is the answer here? And if you answered letter C, you got that correct. So the answer here would be, it must be upsetting to hear that. This response reflects therapeutic communication. And as you guys know, during your SLA and also your CBA, therapeutic communication is one of the main things they will assess you in during your Inspire Global assessment. Saying to the patient who is having voices, especially if it's commanding voices, it must be upsetting to hear that. This acknowledges the client's feelings without challenging the hallucinations, and that is something that you need to do for clients with schizophrenia. And this will also help build trust and rapport rapport with your client. And this is something that's very important for you to do in mental health. So here's the test tip for you for mental health. When you're doing your CBA, choose answers that reflect superior communication, that reflects empathy, and also validating the client's feelings. Avoid responses or choices that argues, that offers false reassurance, or ignores the client's feelings behind their statement or what they are telling you. And always remember, for mental health, emotional safety builds trust and rapport with your client. Also, if you need more resources, you can go to my website www.nursingcollective.co and you can download a free PDF book I made for you. It's called Survival Guide for IENs. So if you haven't yet, download that one. Also, I just made a course specially made for IENs preparing for the CBA and SLA. It has over 300 CBA practice questions, and it also contains videos of me lecturing and going over and breaking down case scenarios that mirrors what you might see during your SLA. So if you're unsure how to study, what to focus on, or just feeling overwhelmed and you need more guidance, you can go to my website, just go under the course and you can find out more information about it. Next question. You are documenting your assessment of a newly admitted client who is disoriented and has a large bruise on the left hip. Which of the following statements is the most appropriate for the nurse to document? A. Client is confused and probably fell at home. B. Large bruise seen on the left hip appears to be from a fall. Letter C. Client confused, 6 cm dark purple bruise present on left hip, states I don't remember what happened. Or letter D. Client confused, bruise likely due to trauma. And the answer here would be letter C. Client confused, 6 cm dark purple bruise present on left hip, states I don't remember what happened. This response uses objective data, which is the measurable bruise description, and subjective data, which is the client's statement, without assuming the cause of the fall of the patient. Also, it follows the documentation principle of being factual, it's concise, and also non-judgmental. And that is something you guys have to remember when you are documenting or when you're charting, not only for the CBA, but also for your SLA as well. And here's my test tip for you. In documentation questions, never assume or interpret. Instead, only document what you observe and also what the client states. So you have your objective data and your subjective data. Also avoid words such as appears, likely, or probably, as those are judgmental words that you shouldn't be using when you are documenting or you're charting. A client with depression reports poor sleep, weight loss, and a lack of interest in usual activities. Which nursing diagnosis is the highest priority? A. Social isolation. B. Risk for suicide. C. Disturbed sleep pattern. Or letter D. Imbalanced nutrition, less than body requirements. And if you chose letter B, risk for suicide, you got that correct. Well, all these nursing diagnoses are actually correct and they are all relevant. The highest priority would be risk for suicide. Clients with depression, weight loss, hopelessness, they are at risk for suicide the most, and they need further evaluation. So here's a test tip for you. When safety is mentioned or it is implied when you are talking to your patient, it usually takes the highest priority in mental health or also in pediatrics. So think about what could result in harm and then address that first. And here's our last question. A nurse is caring for a client with generalized anxiety disorder who is pacing and wringing their hands. What is the nurse's best action? A. Tell the client to take deep breaths and relax. Offer to sit quietly with the client. Letter C. Give the client a PRN anxiolytic immediately. Or letter D. Redirect the client to a group activity. And the answer here would be offer to sit quietly with the client, so letter B. Sitting quietly with your client promotes therapeutic support but also presence without overwhelming your clients, especially for someone who is having anxiety or even panic attack. Also, this will help de-escalate the situation without using any pharmacological methods first. When you are providing interventions, If you have the options, it's good to start with non-pharmacological methods first before giving medication, especially when it comes to mental health as well. Also, this will demonstrate emotional safety for your patient, and this will help build trust and rapport as well. And here's my test tip for you for mental health questions. Prioritize emotional safety, physical safety of the patient, and you prioritize building trust, establishing a calm environment, and using non-threatening interventions. Also, medication is not always the first step. Consider the least invasive, non-pharmacological if you can, and the most supportive actions first. And that's it for our video for today. I hope you guys enjoyed that. And if you need more resources or coaching for your CBA or your SLA, or just in your Canadian nursing trainee, feel free to check out my website, www.nursingcollective.co, for resources. Otherwise, thank you guys for watching, and I'll see you in the next video. Bye!
If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video!